Tonight, the U.S. is lacking a crucial weapon to slow the outbreak. That's adequate testing. Just over 5,000 patients have been tested in this country. Now, at this point in South Korea's outbreak, more than 100,000 had been tested. We asked President Trump today about the government's sluggish response. Why has the U.S. been so slow with testing? Other countries have tested tens of thousands.
No, I think the U.S. has done a very good job on testing. We had to change things that were done and that were nobody's fault. Perhaps they wanted to do something a different way, but it was a much slower process from a previous administration. And we did change them. We made the changes. But the testing has gone very well. And when people need a test, they can get a test. When the professionals need a test, when they need tests for people, they can get the test.
The president says they can get a test, but a spokesperson at MedStar Washington Hospital Center right here told us as of today their hospital had not received any test kits. And that hospital is not alone. We turn now to Dr. Jon LaPook on why these tests are so important.
Today, Health and Human Services Secretary Alex Azar said as of this week, America has ramped up its production of coronavirus tests.
1.1 million tests had been shipped out to public health laboratories and private labs and hospitals. At this time, another 1 million tests are available to fill orders or are being shipped.
But according to a database looking at state results, just over 5,000 people have been tested in the United States since January 20th, when the first positive case was detected. In comparison, South Korea is now doing more than 10,000 tests per day. Tonight, the administration still has not explained why it refused to use a test created by the World Health Organization weeks ago. By the end of February, 60 countries had reportedly gotten test kits from the WHO. But the Centers for Disease Control reportedly decided to create its own version as the virus was spreading.
No one is answering that right now, and I am really frustrated with that. I'm frustrated that it happened.
And without knowing where the positive cases are, public health officials are hampered in their efforts to track and contain the virus.
We are only going to get on top of this outbreak if we know who is affected and able to, quarantine people rapidly.
Some state health departments say they're worried.
We've only received 2 test kits to date.
New York State only began its own testing 10 days ago, and it currently has the largest caseload in the country. Dr. Howard Zucker is Commissioner of Health for New York State.
We are ramping up. We are prioritizing those who are more at risk for developing a more serious infection.
On Capitol Hill today, CDC Director Dr. Robert Redfield was asked about the nation's capacity for testing.
We've underinvested in the public health labs.
There aren't enough people to
There's
run
not
the
enough
tests?
equipment, there's not enough people, there's not enough internal capacity.
And Dr. Jon LaPook joins us now. So if nearly 60 other countries used the WHO test, why didn't the U.S.?
Well, Nora, this afternoon, a senior HHS official told CBS News that it considers that WHO test to be research only, not diagnostic, which I interpret to mean they don't trust it. Meanwhile, we know that testing is the key to containment, especially early in an outbreak when you want to try to identify people, isolate them, and figure out who their contacts are. We're happy to have it now, especially as a clinician. I want to know who has it and who doesn't have it. But at this point, maybe it'll help us with containment because it'll help us to say what's the community spread, and public health officials can figure out measures to try to at least slow the spread.
Such an important point. Dr. LaPook, thank you.